Alzheimer's, is this something that's increasing? Are you seeing this at an increasing rate? Is there a reason why we are seeing it more these days, maybe than we saw in the past, or are we just diagnosing it more frequently? Or
diagnosing it more frequently. People are going to the doctor more. You know, we got healthcare exchange. You know, a lot more people out there getting insurance that didn't have it before. Actually, the Alzheimer's are more going to be the Medicare patients that had it, but people are going to the doctor more. Information is more available, and you know, people are getting help. There are more medicines out there for it. But that's a perfect example of that population of patients that needs to take someone with them to the doctor so they can articulate on their behalf. Because, you know, as I said, you know, if you have a grandmother or a mother, you just drop her off and she can't let the doctor know what's going on, he's not going to be able to do as good a job.
You know, in the old days they said, well, he's suffering from old age, or, you know, he's old, he's forgetful. But there's a name for it today, Alzheimer's.
Right.
And I've witnessed it because my grandfather had it.
Oh yeah.
And he was older. I mean, it wasn't like he got it young, but he got it, and he was you know, he just basically became kind of looking around and kind of became sort of like disconnected.
It's very difficult.
But how I'm curious. How does this become such a serious affliction that it can be fatal? I mean, why? I mean, it doesn't seem like there's anything fatal about not really knowing where you're at.
The number one reason why, you know, it becomes fatal is people get more infections, they take care of themselves less.
I see.
But the bottom line is it can be a very debilitating disorder. That's why it's a good idea if you have a family member that's starting to have these problems, write it down. And when you go in with the doctor, say, Doc, you know, Mom, you know, she hadn't really been, you know, very attentive to herself lately. Maybe she forgets to take a bath some days.
Well, what is is there a treatment that works for that?
Yeah, oh yes. But now here's the deal. With Alzheimer's disease, you have to catch it early and start the treatment early.
What's the treatment?
Well, the main one that we use is Aricept.
It's a drug?
It's a medication, drug, and what it does is it works with the imbalance in the brain. But the catch is you got to start it early, because it doesn't, to a certain extent, it does not really reverse the changes, but it slows the progression. So if you have a family member that's exhibiting symptoms of Alzheimer's, they're very forgetful, and you know, you let the doctor know, then they can go ahead and start the medication, and their function level can be preserved. But if you ignore it, and then you get to the point where they can't do anything for themselves, their activities are none, and you start the medication, there's not a whole lot of effectiveness of the medication at that stage.
Is it similar to some of the psychotropic drugs that they use for depression and such, the serotonin levels? I mean, is it something that when you treat Alzheimer's, is it something that you're treating the brain?
You are, but you're dealing with different neuropeptides. You're dealing with the dopamine levels in the brain. It's a different pathway. Now, they are using some of the neuroleptics for Alzheimer's with severe anxiety, but that's a whole different deal. But the bottom line is the take-home message for the viewing audience is, if you have a family member that's exhibiting those symptoms, go ahead and get them checked out early. And that way, you know, that they can be properly evaluated, and if they need Alzheimer's medication, it can be initiated in the early stages when it can actually be helped. Or they might have depression. Some elderly patients that have depression have symptoms that are very similar to Alzheimer's, and they might need the depression medication. But the bottom line is you have to let the doctor know.
Okay, here's something now. Now this is an unscheduled question, but we know that women go into what's known as menopause. And is it possible that men, when they go into middle age, some men complain of depression?
Oh yes.
And is it possible that a drop in the male testosterone level would bring on depression?
Oh yes. Any change in hormones can have different effects on specific individuals from one to one. But the bottom line is there is a higher prevalence of, you know, men having some depressive symptoms with low testosterone levels. That's why, you know, for a lot of my men, you know, in my questioning, especially when they give me different parts of the history that might lead me in that direction, I'll do a testosterone level. And I've had men that have had lab results to come back to show low testosterone. Now, that's not something I treat as a family doctor. Some family doctors do treat it, but I refer them to an endocrinologist, which is a hormone specialist, and they'll put them on this testosterone, either injections, they can use different gels, topical for the skin. But the bottom line is, a lot of the symptoms that these men are experiencing, they can be alleviated so well. I've had so many men that say, man, I never thought that I could feel that good again, you know.
Because of the testosterone therapy.
Oh yes, you know, they have energy.
Depression leaves.
Well, we can't say depression leaves, but in a lot of cases their mood is made better. And also a lot of the wives, well, one wife pulled me to the side. Thank you, doctor. Thank you. She was very happy, and I think you might know why she's happy. Her husband is able to perform better and give her a more loving physical relationship.
You know, and I would imagine another antidote for this type of situation would be physical exercise, right? Because you kind of get yourself moving and
you
kind of
have
going
a boost of male hormone with the physical exercise, most definitely. But at the end of the day, if someone has a medical chemical imbalance where they have low testosterone, that's something that can be simply evaluated by just a simple blood sample and cured by going to see my buddy. His name is Dr. Wu. That's who I refer to. He's the best endocrinologist in town, and get them on the medication, and in a lot of cases their life can be changed.
Okay, the last question, I wanted to get to it before when we were talking about Alzheimer's. The span of, we usually think of Alzheimer's as something that affects older people.
Right.
But what is the entry level where you've seen relatively young people that have been diagnosed? How young can it be that you might encounter Alzheimer's?
Well, me personally, I haven't witnessed anyone under the age of 55 personally, but I've read about cases where there have been younger cases. Usually, though, it's more prevalent in the senior citizen
Okay,
population.
what age? It's prevalent what age?
60, 65, 70, and so on. It's very rare. It has been documented, but it's very rare that you see it before that age.
So 60, 65 is the usual onset, perhaps, and then later.
Now, if you talk to a psychiatrist, because as I said, a lot of the symptoms of Alzheimer's disease can mask depression and anxiety and so on. They may have some cases that are a little less usual just because they have such a great number of people suffering from those problems. But the bottom line is, any type of symptoms that you're having, anything unusual, convey that to your physician. And don't be ashamed about it. You know, because the thing is, as I said, the physician is only as good as the information provided to him. I tell the patients, look at me like a detective. Give me some clues, man. If you give me some clues, I can solve the mystery. And if you don't, I'm helpless. So basically, by you writing down the information, letting the doctor know what's going on, you're helping the doctor do his job. And if you have a doctor that, you know, does not want you to have your list and sit down and take the time, you might need to find another doctor.
Well, doctor, we appreciate you coming on and talking to us, to our audience. I hope that we've helped some folks out there. Every time we do one of these shows, I think that we are helping people.
Oh, yes, we are.
Thank you, Doc.
Hey, thank you.
I appreciate you very much.
All right.
Dr. Timothy Quinn, and thank you for being with us. Stay tuned. Well, thank you for joining us for this edition of Nightique. We thank our guests, Dr. Timothy Quinn and Mark Jones from the city of Clinton, for being with us.